I'm one of the vice presidents for the Public Services People Managers Association, and I'm also an assistant director in Leicestershire County Council, responsible for human resources, operational property, and transformation activity as well. And I'm going to talk to you for about 15 or 20 minutes around kind of our experience in Leicestershire, particularly on sustaining a healthy workforce. And just see if I can move the slide. Okay, it's been, and again, this is fairly obvious for people, but it's been a unique 18 months. We were all in the same boat, March 2020. It was an overnight change, and we all, as organisations, had to adapt very, very quickly. And when we looked at our organisation, lots of immediate concerns, but they included what we were doing around business continuity and those arrangements kicking in across a range of organisations, our IT capacity, how stable our network was, the availability of kit for people to be able to work effectively remotely or just even connect to our network. Communication and engagement was an initial concern. It remained hugely important right through the pandemic and remains important now. Staff wellbeing. Suddenly, everybody apart from our frontline workers were remote, and it's more difficult to just keep a grip on what's happening with people and their own wellbeing. Huge number of risk assessments had to be done, both for frontline workers, but for lots of other activity as well. And just that general concept of managing considerable uncertainty. And also some services being stood down. So suddenly, people were stopping doing the jobs that they were doing, or they were doing different work. And again, all this just over the overnight and then over a few weeks effectively. So in some ways, the question was really, well, as a result of that, did we just carry on as we were, or what changed? And I think there were some positives and there were some negatives. So there were certainly some innovative and agile approaches that people adopted, and we saw some great examples of just cutting through the traditional local government public sector bureaucracy that we all know and love, and decisions being made very quickly. Greater collaboration, so cutting down on service and departmental, just cutting down through those barriers. And much more flexibility of approach. So a real kind of one team approach, because we had a single set of problems to address. Certainly, people felt isolated. There was an impact on well-being and mental health. And I'll talk a little bit later about what we started to do to understand that and then do something about it. We gave an immediate focus to equipping managers to think about how they led and managed remotely, because it's a very, very different skill set. We made sure our workplaces were COVID secure. Again, there's probably nothing here that other people haven't done, but it was a bit of a journey for us in Leicestershire. Continual focus on the quality of communications and engagement. We furloughed, probably at a maximum, we had about 1,000 staff furloughed, lots of part-time staff within that, but for our income raising services who couldn't work, we used furlough and kept in touch with people and explained it. We kept the pay at 100% instead of 80%, so tried to manage it as best we could. And I think what we saw was real evidence of ongoing resilience at an individual level, but also a very clear negative impact on some colleagues. And actually, I think when we got later on, perhaps after Christmas into January, we had some comments around our most resilient people, the cracks were now showing. So it was really affecting our most robust and resilient colleagues. So different phases at different times of the pandemic. So as I said, wellbeing was one of our biggest concerns during COVID and continues to be now. I think what's pleasing for me is that it became quite an important agenda item for our senior team, our corporate management team, and also for members as well, who were giving regular COVID updates to. They weren't just focusing on the public health update. and what was happening in the community. They were also genuinely interested and concerned with what was happening around staff. Mental health, stress and depression already accounted for 30% of her sickness absence. That's near enough in line with certainly other counties that I've talked to, but it's a high figure, and that's just people who are off sick. So there may be others who carry on working who are also struggling with mental health challenges or stress or depression. So one of the things we did was we said we need to understand where people are at. So we did 3 tailored wellbeing surveys, and we got a really high response in the first one. It started to tail off in the other 2 because people probably felt they were telling us the same thing again. But we got probably a 50 to 60% response rate just within a matter of weeks. And it's certainly not one of these surveys where you come up with an action plan in a few months. It had to be dynamic and quick. We were very honest about what was out of our control. So where people were concerned with, for example, the economy, the impact of the virus, to say, yeah, we understand those concerns, we're prepared to talk about them. They're not within our control as an employer, but there were other things that were in our control. And what we sought to do was build on what we thought was a really good existing wellbeing offer, quite a fundamental one, probably not as cohesive as it could have been, but to then make that context specific. So, an example would have been, we've got an in-house counselling service. Overnight, they moved from face-to-face to telephone. Arguably a simple change, but it was a very different operating model for them. So a broad response to the surveys, as I said, 50% response rate. We had some concerns. We also had some positive feedback about what we were doing as a council. They felt that our approach to keeping services going and communicating around what was happening during the pandemic was good. As I said, we needed to do an immediate response, so we treated it more as an ongoing conversation, and that helped. So that we're regularly talking about wellbeing, putting wellbeing bulletins out, etc. It was really important to have honest, transparent and clear messages, and our communications team were absolutely pivotal in helping us with those, and they landed well. And I suppose when we got mixed messages from the government, for example, last August, I think the Prime Minister said, right, everybody back to work. He did a U-turn on it after a week, but when he said that, because our messages as a council were really clear about working from home, we didn't see any uptick in the numbers. People kind of listened to us and the consistent messages that we were giving. We did some fairly simple stuff as well. So we created a one-page manager's charter, which was just about saying to managers, you need to make sure you engage with all your staff. Those who are kind of harder to reach, those who are not putting their video on Teams meetings, those who are, struggling, ask them how they are, ask again, those sorts of things, and make sure you think about different ways to engage and communicate. We also put an equipment allowance in place to allow people to buy equipment to make them to help them work more effectively and safely from home. We had a good take up on that. Just a general focus on good mental health, so kind of turning it round and talking about positive mental health. And then I think I've said this before, support and coaching for managers in terms of leading and managing remote teams. And then I think getting the balance right in preparation for a new long-term model. So some of the things we were doing during the pandemic, we knew we were already running a ways of working program. We knew we weren't going to go back to 5 days a week for everybody in the office. So actually, this has acted probably for longer than we wanted, but this has acted as a lead-in to our new longer-term model. And most organisations are looking at a hybrid model. For us, we were on that journey. In some ways it's speeded up, and in other ways we're kind of saying, well, what are the gaps now and what do we need to put in place to make sure this is effective in the long term? And then again, last point around our broad response, that there was lots of flexibility, or as much as we could, and again encouraging managers to create flexibility. So for example, parents working from home when schools were closed, had to be some flexibility and some understanding of what people could achieve and when. So just a little bit more detail. We launched a return to work walkthrough video so that people had an idea of what it would be like to come back to a COVID secure office, because it is very different. Really important point. We considered how we should thank people for what they're doing, for what they were doing, how they adapted. And there are either general messages or some personal messages from directors to individual members of staff. As I said, it was very much a focus on you said and we're listening, we're taking action, response to those surveys and being clear about what we couldn't influence. We were as transparent as possible. So the huge budget gap that was created with just the sheer cost of responding to the pandemic, how we were going to address it short term and long term, what that might mean for jobs, how it would build into, I've said MTFS, that's a medium term financial strategy, so a 4-year strategy, how it would impact on our future trading plans, because at that point, a number of our traded services, principally with schools, just had to stop. There was no trading, schools were closed, we were furloughing staff, so it created all sorts of levels of concern. And then thinking about live themed events for staff groups, great ways of getting messages out to big numbers on using Teams, for example, using this platform, Microsoft Teams, disseminating key messages. And then thinking about questions and answers for managers, and we've had regular senior managers briefings every couple of weeks. We created a book of Wellbeing, which effectively was kind of telling some stories about what people were doing to look after themselves and look after colleagues, and we put some key survey messages in there. So since the 19th of July, we've taken a very cautious approach. COVID safety measures are still in place today. We're still running at up to 20% of capacity for buildings, looking at either business need or personal circumstances or mental health as reasons to be in a workplace and have that signed off by a head of service. But we're really conscious that many colleagues want and need to see each other and other people. So it's not quite written right. So that they're able to mix and to network and feel less isolated. So we're looking at how we can create collaboration spaces. We're starting to allow slightly bigger meetings, and it's just gradually changing, but in a COVID safe way. So really, there's this opportunity from July to September, and to move from the recovery phase into longer term model. And I've said, but no elastic band. We're not rebounding to what it used to be. So for us, that would have been 3,000 people in a main campus. That's not going to happen in the way that it did before. We'll think of different ways to use the campus. So I think there's also a focus on personal resilience, and this can be a session in its own right, really, because that's been severely tested. How do we either preserve resilience? How do we build people's resilience back up? So thinking quite carefully about how we do that. And then we've had something that we've called a summer sort out, which is people coming in and tidying up and what was effectively their desk, because it won't be their desk in the future. There'll be a desk booking system. They may only use a desk once or twice a week in the office. So again, it's decluttering of personal items, creating more space in offices, gets the message across that things are changing. And then just talking about our long-term plans, very much a focus on sustaining a healthy workforce. So we've got to keep the focus on our wellbeing offer. And as I've said, this hybrid working, if we get the mix right, and all our services have produced individual action plans. So trying to get the mix right between remote working and presence in the workplace. So we created a framework, and then each service can create their solutions that work for them, as long as it's within that broad framework. As I said, collaboration spaces where people can get together, where there's a need to get together, and I want to keep wellbeing as an organisational priority, and I think we'll be able to do that. Focus moves from presenteeism to managing by outputs and outcomes, and lots of work to support that. It's very It's easier in some areas to manage outcomes and outputs than it is in others. So it's something that we need to help people with. And then we're just starting some work on encouraging innovation. So thinking about the culture that we need around innovation, thinking about some of the really good stuff we've done in the last 18 months and not losing that, that we're able to work in a very different way and achieve results in a quite, sometimes quite innovative way. And then just taking the opportunity to continue to modernize. So we've got a digital program, and we, like everybody else, we will try and automate, we will try and get rid of repetitive manual tasks, etc., and hopefully enrich jobs. That kind of links to innovation as well. So it's a range of things that we're trying to do to push the organization forward. So our approach in terms of ways of working, which is what we've called our program for effectively our workplace strategy, is that we're revising the business case now, because the business case that we had 2 years ago doesn't quite fit because of the changes. We brought our IT spend forward considerably as an example. But we're taking a planned and measured approach to moving to the new model. That action planning I mentioned at a service level, we're doing lots of space planning. We've got some professionals in doing that with us. Lots of comms and engagement. That's the thread that comes through everything. Making sure we're rolling out the right technology. It's great just to give everybody, some kit and say you're off you go. It has to be the right technology for the work they're doing. Keeping those best bits of our wellbeing offer in place. Working in the background on innovation and productivity and effectiveness, and thinking, what does that mean at an individual, team, service and organizational level? And then ongoing support for managers as we move to the new model. And then really importantly, benefits realization. So I've just taken a few of the benefits out of the business case, because there are many benefits that we need to drive out from our ways of working program. And I think the most relevant, I've mentioned some of these, are productivity. We should be able to improve the quality of our recruitment, better retention, lower turnover, hopefully reduce sickness absence, then thinking about the right work-life balance for our colleagues. Ultimately, and maybe that should be nearer the top, the quality of service to the customer and the relevance of the service to the customer. Enhanced engagement, so keeping that focus on engagement. And then things like, carbon reduction. We've got targets, we've got a pledge to reduce carbon, become carbon neutral. So things like reduced business travel, less time spent traveling in their small way will contribute to that. So that's effectively all I wanted to say. It's a very quick run through my thoughts on sustaining a healthy workforce. So thank you for listening. And if anybody wants to get in touch and have a further conversation, it's gordon.mcfarlane@leics.gov.uk. Very happy to have some conversations. Thank you very much.